Hey everyone, welcome back. Today we are going to start a two-part lecture on therapy and treatment. So to begin today, I want to remind you about kind of a theme throughout this entire course. And the theme throughout this entire course is we're trying to figure out, why do people think, feel, and act the way that they do? And we've done that all year. We've tried to answer this complicated question. And time again, we keep coming back to the perspectives of psychology, right? How would a psychoanalytic try to explain how we think, feel, and act? How about a cognitive psychologist or a behavioral psychologist? So, today, what we're going to do is we're going to start thinking about those abnormal behaviors that we've talked about all year. We've talked about mood disorders, anxiety disorders. We've talked about schizophrenia and dissociative disorders. And when we have these abnormal thoughts, feelings, and actions, when we try to figure out, well, why are we thinking, feeling, and acting this way, a lot of times the cause and then the resulting therapy and treatment is dependent on the perspective itself. So it's important we have a strong understanding of those perspectives before we dive into the material for today. So I want you to take a look at this chart here. When we're thinking about treatment and therapy, we can break it into lots of different categories. You'll see on the left hand side this term psychotherapy. And one of the biggest divisions of treatment and therapy is psychotherapy, or what we sometimes call talk therapy, and then biomedical treatment. And I'm going to get into those two boxes here in just a moment. Today, for this lecture, we're going to spend essentially the entire time talking about this left side of kind of our chart here. We're going to be talking about different types of psychotherapy. And then in part two of our lecture, we will touch on the biomedical treatment that is sometimes used to help with different disorders and mental health issues. So let's focus just on these two red boxes, okay? If we look at just those two red boxes, that's psychotherapy and biomedical treatment. And I kind of have these textbooky definitions here on the slide. Psychotherapy, again, think this is going to be an interaction with a psychologist trying to figure out the root of the problem. What is causing the issue? With the hope, with the goal being that we can redirect that thought process or redirect that behavior to hopefully show some relief toward the client. Whereas with biomedical therapy and treatment, this is when we are trying to essentially reduce symptoms. And perhaps the most common form of biomedical treatment is going to be some form of psychoactive drug that a person takes. But as you will find out in our next lecture, they are not all simply medications. You'll see at the bottom, medications and psychotherapy or talk therapy are often used together in combination to help people reduce their symptoms. So I'm going to back up for just a moment here. Back to this slide. We will have four slides today. We'll have a slide on psychoanalysis and humanistic, those we would consider kind of our historical approaches to psychotherapy. And then we'll have a slide on behavioral techniques and cognitive techniques. So you can use that to structure your notes. So let's go ahead and dive into that very bottom left box there, psychoanalysis, and how psychoanalytics would attempt to help someone suffering from different mental health issues. So with the psychoanalytic approach, as a reminder, there's a depiction of Sigmund Freud. It's not an actual picture of Freud, of course, but it kind of looks like him there. And if we remember the psychoanalytic perspective, right, the thumb of psychology, why do we think, feel, and act the way that we do? Well, because of something that exists in our unconscious mind. And so the goal of psychoanalysis is to try to tap into our unconscious mind and resolve those problems. And there are some different ways that we can go about trying to do this. By far, the most common way to try to tap into someone's unconscious mind is through a process that we call free association. We learned in an earlier unit, Unit 5, about this idea of defense mechanisms and how we have these filters that our ego implements to try to protect us, right? We put these filters up that protect us from things that we say or perhaps even things that we think about. Free association is an attempt to get rid of those filters. Through free association, a psychoanalytic would ask their client to essentially start talking and just keep talking. Talk, 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 with the hope that you may eventually slip and start to project information that is in your unconscious mind. Sometimes free association can be assisted through things like projective tests. Remember those ink blots and the thematic apperception test. But other times it could be kind of a stimulus and response. I'm going to say a word and I want you to reply, or I'm going to give you a prompt and I just want you to start talking. So I might say summer day, and you just start to talk about an average summer day. And through you talking, I'm listening for certain words and phrases that may lead me to better understand what's happening in your unconscious mind. Sometimes what might happen is you might start to show resistance. And so this is the idea that I say, hey, let's talk a little bit more about your relationship with your father. And if you're resistant to this topic, if you don't want to talk about this, then that's cluing the psychoanalytic into the thought that, well, maybe that is part of the problem. If you're showing resistance to have this particular conversation, maybe this is something we need to kind of dig into a little bit deeper. We also see this idea of transference take place during psychoanalytic therapy. With transference, we have a client who starts to project displace their feelings toward someone in their personal life toward their therapist. And so during therapy, a client may start to say that they love their therapist, or they're jealous of their therapist, or maybe they hate their therapist. And they start to show these strong emotions to their therapist that, according to theory, are being displaced from their actual source. And so these are things that someone who practices psychoanalysis are trained to listen for and look out for. The second kind of historical perspective for talk therapy is humanistic therapy, or what we sometimes call Rogerian therapy. And it's named after Carl Rogers. You can see a picture there, the guy on the left, that's Carl Rogers. And we talked a little bit about humanistic psychology, right? It's the ring finger perspective. Remember that according to humanistic psychology, why do we think, feel, and act the way that we do? Because it's our choice, because we choose to do these things. We set these goals for ourselves. And this is a lot of kind of how we view humanistic therapy as well. Humanistic therapy, founded by this guy named Carl Rogers, is this idea that how would a therapist ever know your problems and how you should solve them? You are the one who's aware of the problems that you have, and you know the solutions. The purpose of therapy is for a psychologist to help you decide how are you going to achieve that. So we call client-centered therapy, or it's person-centered therapy, where the client knows what's wrong, likely knows what they need to do, and the therapist is there simply to help guide them. But a Rogerian therapist would never say this is what you need to do. Now Freud would, right? A psychoanalytic would say these are the steps that you should take. A Rogerian therapist would say, hey, I'm here to help you figure out how to solve this problem, but I'm not going to give you the answers. And this kind of sounds like a cop out. I understand that, but it can be really effective, right? If you can have ownership over the goals that you make, this is what I want to achieve, then you may be more likely to follow through with it. And this is achieved by using different techniques such as active listening, where the therapist, again, isn't giving advice, but is kind of mirroring back how you feel. So if I understand you correctly, it sounds like you're having issues with your roommate. Can you tell me a little bit more about what it is that's bothering you? I'm not offering any advice. I'm just being very clear that I understand that you have an issue and I want you to see if you can talk through it. It's the idea of active listening. And then also this concept of unconditional positive regard. Psychoanalytic theory can be relatively dark as they look at these drives that exist in your unconscious mind and these urges and impulses that you have. Whereas humanistic psychology is more positive. Unconditional positive regard is where a therapist will not pass judgment on their client and instead say, let's say you have a person who's struggling with addiction, and they go to their therapist and say, hey, I messed up. I fell into some bad habits this past weekend. Unconditional positive regard is saying, I understand that we had this hiccup, that we messed up, but what can we do to try to make sure it doesn't happen in the future? So not passing judgment, but again saying, we're going to get through this, and let's try to figure out how we are going to get through this. Now, the one thing that psychoanalytic theory and humanistic theory have in common is there's a lot of interpretation involved, and also it's trying to figure out, well, why are you feeling this way? Well, when we start to get into more contemporary talk therapy, the cause is sometimes known. Imagine that you're really anxious before an exam. Well, you know why you're anxious. You are anxious because you're about to take a test. We don't have to dive into your unconscious mind to try to figure that out. You know what it is. And so these contemporary perspectives kind of jump to this next step of, okay, perhaps we have an idea of what's happening. Can we figure out why this is causing some hurtful or negative emotions? And so I want to draw your attention to this third theory of talk therapy, what we call the behavioral therapy. And we had a behavioral unit in psychology. And the idea here, remember, if you remember the middle finger, why do you think, feel, and act the way that you do? Because you've been trained, because you've been conditioned to do that. And behavioral therapy uses the same techniques from classical conditioning and operant conditioning to try to change behaviors. So let's take classical conditioning, for example. You got to think way back to when we talked about classical conditioning and how we are pairing together, an unconditioned stimulus with a conditioned stimulus to produce a conditioned response. Back to the old ring the bell and give food so we can get a dog to be, salivating to the sound of a bell. Well, using those same principles, we can try to counter condition you. Aversion therapy. Maybe you have someone who is addicted to alcohol. And so they force themselves, okay, here's the deal. I'm going to put this special medicine in alcohol so that every time I consume this, it makes me physically ill. And you start to pair these things together through counter conditioning that you no longer want that alcohol because you're going to get physically ill. Or maybe you have someone who's addicted to smoking. Right? So they're addicted to smoking cigarettes, and in a time of weakness, they go to the gas station, they buy a pack of cigarettes. Well, yeah, they can try to just throw them away or flush them down the toilet, but at the end of the day, when they're craving that nicotine, they're likely going to go get a pack of cigarettes. So this person goes, they get their cigarettes and they take them and they dip them in vinegar. So if they want that nicotine, they can have it, but it's going to taste awful. And they're trying to make this association between the cigarette and the vinegar, the awful tasting. So through counter conditioning, specifically what we call aversion therapy, you might be able to overcome these unwanted behaviors. Another type of classical conditioning that we can use to help overcome unwanted behaviors would be what we call exposure therapy. And this is really helpful for fears and anxieties that we may have. There's a couple different types of exposure therapy. There's something that we call flooding, and you've maybe seen TV shows about this. This is the idea that someone's afraid of heights, and so they blindfold them and fly them up into an airplane and, put a parachute on them and push them out of the airplane. So it's this whole trial by fire. We're going to throw you in the deep end and you're just going to have to figure it out. It's not highly recommended, though some people tend to say that this works for them. A much more appropriate form of exposure therapy is what we call systematic desensitization. If you think about that phrase, systematic desensitization, they are systematically, right? They have a plan, they have a formula desensitizing you to something that causes fear or anxiety. And so this usually includes creating a hierarchy of some form of anxiety. Take, for example, a person who is terrified of public speaking. Well, what they would do with a therapist is they would think, okay, what is the least anxiety provoking part of this event that causes you anxiety? And maybe the least anxiety provoking is just the thought of public speaking. And then above that is looking at pictures of crowds. And then slightly higher on the hierarchy would be being in a room and giving a speech to 3 people, and then 10 people, and then 50 people. And you can see that as we go higher and higher up the hierarchy, there's more and more likely that you experience anxiety. Well, through systematic desensitization, a therapist would slowly work you up this hierarchy while simultaneously calming you down. And so they would get you thinking about public speaking. And when you start to get anxious and your heart starts to race, they calm you down and they work you through therapeutic techniques to calm the body until you can talk about public speaking without getting anxious. Then they have you look at pictures of crowds and your heart starts to race and they say, okay, let's calm down. And then after that, they put you in a room with 3 people and they have you give a speech. And you can see that they work up the anxiety hierarchy while simultaneously trying to desensitize you to that anxiety provoking stimuli. And then operant conditioning, token economies. This is review. We talked about this earlier this year. Remember, token economies is when we give you some kind of token that in and of itself carries no value, but you can trade them in for things that do have value to try to produce appropriate behavior. And this is really common in things like elementary school, right? Where if a student is doing an appropriate behavior, maybe they get a sticker on a chart, and at the end of the week, they add up all the stickers and they can go shopping in the little school store for erasers and toys and other cool stuff. Well, token economies are actually really common in the mental health field as well. When you go to mental health institutions where appropriate behaviors, actions toward eliminating unwanted behaviors are awarded with tokens that can then be traded in for um, valuable goods. And then finally, the last slide for today, this is the fourth type of talk therapy, is cognitive therapy. Now, with cognitive therapy, it started with this guy named Aaron Beck. And the idea behind Aaron Beck is there's this triad of how you think about yourself, how you think about your world, and how you think about your future. And Beck says that many of our mental health issues, he wrote a lot about depression, deal with people having a pessimistic understanding of themselves, their world, and their future. If you look at that graphic on the bottom left, Beck helped people understand that our thoughts truly do influence how we feel. How we feel is going to influence our behaviors, and then our behaviors will influence our thoughts. And what can often happen is something crummy happens, which then leads to us feeling bad, right? That happens a lot. There's a negative event, and then because of the negative event, we feel crummy. Well, Beck, and then further studied by a guy named Albert Ellis, wants to bring in the thought process, the cognition, right? That's the key. That's what you want to put a star next to. That we don't just jump from negative events to negative feelings, that there's cognition in the middle. It's how we think about things. And so Albert Ellis wrote about, coined this idea of what we call rational emotive behavioral therapy. It's a very specific type of cognitive behavioral therapy where he really wants to emphasize the belief that exists between an event and an emotion, right? And you can see that chart on the bottom right. And so let's go back to public speaking. You have someone who is terrified of public speaking, and if they're talking to Ellis, for example, they may say, I'm terrified about public speaking. He would ask why. I'd say, well, because I'm sure that I would do horrible and get really embarrassed, right? Well, Ellis would say, well, let's pause here. Let's take a time out. You say that if you had to speak in front of a group that you're going to do horribly and you're going to be incredibly embarrassed, right? Well, he wants to draw your attention toward the belief itself. What is it that makes you think that you're going to do horribly? And is that a rational belief or is that an irrational belief? Because more often than not, when people suffer from these mental health issues, according to cognitive psychologists, it's because they have irrational beliefs, right? Cognition, it's how we think. They say that the perspective is wrong. And so, if we can change from an irrational belief to a rational one, we can go from experiencing unhealthy emotions to healthy coping. And you can kind of see how that plays out in the bottom right. It's likely that you won't do horrible, which won't lead to embarrassment. And the reality is, even if you do mess up a little bit, will that really be the end of the world, right? Is it rational to believe that this is going to be this horrific, horrible, catastrophic event that you believe it will be? Because more often than not, it won't be. All right, lots of different names and different theories for today. I hope that makes sense. Our next lecture, we'll talk about the biomedical treatment that we can use either as a replacement or more often as an addition to the ones that you saw here today. If you have any questions at all, don't hesitate to reach out to me, and good luck.